Should pregnant women take the COVID-19 vaccine?
Hey everybody, this is Dr. Ben, chiropractor in Petaling Jaya, Malaysia. Check out the timestamps in the description box below, and then you'll be able to jump to whichever section you want to view. First, let's talk about safety. So if you are pregnant, is it safe to take the COVID-19 vaccine? So according to Pfizer, they've done animal studies, and it shows that there is no reproductive or fertility toxicity. Now of course, we want to find out what about in humans? Pfizer has also started recruiting pregnant women for their clinical studies, about 350 pregnant women, and by August next year, there are about 4,000 pregnant women. 4,000 will be a good number to be able to judge and assess, is it really safe for pregnant women to get the COVID-19 vaccine? So next issue we have is it effective? Does taking the COVID-19 vaccine protect the mother and the baby? So the small studies were done using Pfizer and Moderna vaccines, and they have found, yes, you can detect antibodies in the mother's milk and also across the placenta. What this suggests is that these antibodies will be able to provide protection for the mother and also for the baby. Bear in mind that some of the studies are quite small.
The studies were conducted separately by Dr. Catherine Gray and Dr. Iris Collier.
So of course, the total of 100 over women who received this COVID-19 vaccine is rather small. Yes, I know it's rather small, but it's a good start to be able to conduct further studies to find out whether it's effective to protect the mother and the baby.
Some of you are skeptical because news reports show that some who got vaccinated still got infected by COVID-19.
In a way, that is true, but it's also true that taking the COVID-19 vaccine will prevent your body from overreacting to the virus inside your body. Let's talk about the danger of pregnant women getting COVID-19. Two examples, and one is quite severe. Over in Morocco, Yasmin Aburida reports a 30-year-old pregnant woman. She was in her third trimester and she got diagnosed with COVID-19. She had severe pneumonia, and also she had a premature rupture of the amniotic sac. So the bag containing the fetus broke and the fluid came out, and therefore she needed to have an emergency cesarean. The baby was delivered, so it was a premature delivery, and the baby unfortunately had a severe lack of oxygen, and after a few days the baby died. I have another report here. Jingwang reports a 26-year-old pregnant woman, and this woman was in the second trimester and diagnosed with COVID-19. So she had symptoms like fever, cough, difficulty breathing, muscle ache, muscle pain, and she was given oxygen treatment and medication, and basically after a few weeks fully recovered. We have to admit that some of the treatment which was given to her was quite innovative. Actually, this patient received a reduced glutathione injection. So what is glutathione? Glutathione is an antioxidant. So check out my other video where I talk about supplements which can be useful if you're diagnosed with COVID-19. So there you go. Have a chat with your medical doctor or medical specialist and then decide for yourself. Do you want to take the COVID-19 vaccine? Yes or no is up to you. I'm a chiropractor and this video is for information purposes only. It's not deemed medical advice. So of course, if you do get the vaccine, then your body will react less severely should you actually get infected by the virus. Please hit the like button and share this video. Thank you. God bless.